Hello, everyone. I'm Souzan El-Chazli. I'm the appointed as the Environmental Health Officer for the Ebola outbreak in Congo. So, Ebola, the word is enough to cause worldwide fear. Ebola virus disease is a hemorrhagic fever in the viral family Filoviridia, genus Ebola virus. Of five known species, three have been associated with large outbreaks among humans. Ebola is transmitted among mammals through contact with bodily secretions and fluids, including blood, breast milk, feces, saliva, semen, sweat, urine, and vomit. Fruit bats are thought to be a natural host for the virus, and other animals that have been associated with the virus, including chimpanzees, gorillas, monkeys, and antelopes. And Human virus can be introduced to humans in the same manner through contact with infected animal body fluids or secretions. Cases have been associated with butchering and eating bushmeat. Transmission occurs through the broken skin and mucous membranes. Human to human transmission occurs through the direct contact with bodily fluids and secretions or through indirect contact with contaminated surfaces like bedding, clothing, needles, and medical equipment. No known cases exist of air or waterborne transmission. People can continue to transmit the virus as long as it is present in their system, even after symptoms have disappeared. The Ebola virus in humans, exposure to Ebola virus leads to the Ebola virus disease. It's a severe acute infection with an incubation period. Time from infection to onset of symptoms ranging from 2 to 21 days. Humans are not contagious until they develop symptoms, and that starts like around day 7 and day 9, which is basically sudden onset of fever, muscle pain, and weakness, vomiting, abdominal pain, and diarrhea. Ebola virus disease can also progress to kidney and liver impairment, as well as internal and external bleeding. Hence, it's a hemorrhagic fever. Because the initial symptoms are similar to other illnesses, Ebola virus disease can be difficult to diagnose and is confirmed through laboratory tests. So my role is being an environmental health practitioner. So it includes mainly dealing with assessing risk of potential environmental contaminants from a variety of sources, including infectious diseases such as Ebola virus disease. Therefore, we are uniquely qualified to contribute to epidemiological discussion of the interaction between the agent-host environment and how those interactions might be disrupted to stop the spread of Ebola virus disease. My second focus will be on the occupational environmental health that address issues of risk and exposure in routine work to provide preventative measures that's needed for healthcare workers and others who are at risk of contracting the disease from patients. So my job will start by focusing first on identification and the isolation. Basically, patients who are at risk for Ebola virus disease, if they had an exposure that occurred within 21 days before the onset of symptoms. However, the level of exposure risk ranges from high to moderate to low, or no known identifiable risk. For healthcare workers, the level of exposure risk increases with the number of patients with non-Ebola virus disease they are caring for. Individuals may also be at risk if they have handled bats or non-human primates from endemic areas of Africa, as I mentioned in the first slide. Symptomatic individuals are using contact tracing to quickly identify individuals who may have been exposed to the virus, basically in the context of place, time, and person. Potentially exposed individuals are monitored or self-monitored for 21 days from the date of last contact with the symptomatic individual for any signs of symptoms. Monitoring their vitals is also very essential. Once temperature rise, should be moved into isolation as precaution until proven by the labs that he is Ebola negative. My second focus will be on the risk communication and health education to the public. CDC has a wide variety of health education material available through its Ebola virus resources, including fact sheets, posters, flipbooks, infographics, and videos. Most are targeted toward the general public, but some are also designed for specific subpopulations, such as workers in healthcare settings, airlines, airports, and cargo ships. Also, information include possible travel related exposure, practicing hand hygiene with frequent and thorough hand washing, and safe sex, condom usage for those who have recovered. My third focus will be on the occupational health. Basically, all healthcare workers should use standard contact and droplet precautions as well as personal protective equipment recommended for the care of patients with Ebola virus disease. Also, they need regular, rigorous training and adequate access to the personal protective equipment and the knowledge of how safely to put on, and possibly even more importantly, how to take it off. It's called doffing. Workers need timely updates about changes in recommendation or policies. So the protective clothing, basically, it includes the cover should cover all clothing and skin and completely protect the mucous membranes. Such personal protective equipment, it includes the double gloves, boot covers, fluid-resistant gowns or coveralls, single-use disposable hoods that cover the head and the neck, single-usable disposable face full shields, N95 respirators. Additional measures such as the waterproof aprons may also be required depending upon the patient's symptoms. The combination of the personal protective equipment used should be determined by the healthcare facility providing care. Other occupations that may be at increased risk of exposure includes the cleaning crews for hospitals, ambulances, travel facilities, the travel industry employers like airlines, public transportation, sanitation workers, and work workers. These occupations should also have response plans in place and access to protective personal equipment such as gloves and masks. The environmental infection control, which is very important, if a patient is suspected or confirmed Ebola virus disease is being cared of in a healthcare setting, specific precautions should be taken care of. This includes frequent cleaning of the floor and doffing area, for example, in the protective personal equipment when they take it off. Disinfecting also the contaminated area with cleaning agents like bleach. Primary contaminant and biohazard packaging, and even eventual disposal. The bodies of deceased Ebola virus patients are also very important to be taken care of. So they should be handled only by workers who are wearing the protective personal equipment, and handling should be kept at a minimum. The body should be wrapped in a plastic shroud and double bagged in a leak-proof separate plastic bag. The outside surface of the bags should be cleaned and disinfected before being transported. Mortuary personnel should also wear the personal protective equipment when handling the bagged remains. The bag should not be reopened at any point, and the body should be cremated, placed in a sealed casket for burial, as you see in the picture. Food and safety, basically Ebola virus disease is not food or waterborne. Environmental health and public health practitioners should remain vigilant about the food and the water safety. And Ebola virus disease have been directly associated with the bushmeat. Assessment should consider any potential spread of Ebola virus into domesticated farm animals. Likewise, access to clean water supplies continues to be important. Because Ebola is spread through bodily fluids and secretion, water supplies should be investigated or contamination. So, in conclusion, as the environmental health inspector, I will investigate multiple areas, as I mentioned in the presentation, to target the cause of the source outbreak, then find possible solution for controlling the risk factors. Therefore, there is a new vaccine, which is the VCV Ebola vaccine, was only the specific countermeasure reported to have protective efficacy against Ebola virus during the Africa epidemic and Congo. Thus, vaccinating high-risk population is also essential. However, to solve the case, it will require require the contribution of my teamwork, including the health educator, epidemiologist, policy analyst, state medical officers, and state vets. So I'll be waiting for your responses to be able to collaborate our work in controlling the Ebola outbreak. Thank you so much.